Well, joining me now to discuss the history of DDT, the controversial ban, and the rise of the mosquitoes is Dr. Jane Orient, MD. Dr. Orient is an internist in solo practice, and she is the president of Doctors for Disaster Preparedness. Dr. Orient, welcome to the show, ma'am.
Thank you.
Well, let's go ahead and start out with some history about DDT, about like when it was developed and for what purposes was it developed?
Well, it was developed about the time of World War II, and it has been very widely used in agriculture, but I think the most important feature is its use in public health. It was a great boon to our soldiers who were fighting in the jungles during World War II. It was used to delouse people who were liberated from concentration camps, where many of them had died of typhus that was carried by lice. It's a great insecticide. It kills many different kinds of pests, and probably the one that has been responsible for the most deaths that DDT prevented was mosquitoes. And DDT cut the death toll dramatically from things like yellow fever, malaria, and other mosquito-borne diseases. In fact, it has been credited with saving 500 million, that's 500 million human lives, and its developer got the Nobel Prize for developing it.
Oh. Now, in your own personal estimation, do you consider DDT one of the, up there with vaccinations and sanitation, as great public health achievements?
Oh, absolutely. Absolutely. I don't think that maybe sanitation comes first, but DDT, I think, definitely comes second. I don't think anything else can claim to have saved 500 million human lives.
Yeah. Now, so we had all the success from World War II up for a couple decades, and then things started changing. And thanks to a book, it was by an author named Rachel Carson, and it was called Silent Spring. Many listeners may remember that. Can you talk a little bit about the author, and what are the falsehoods or other problems with the content of this book?
Well, Rachel Carson was not a scientist. She was a very powerful writer, though, and it was a very, very scary scenario that all the robins would die. That was so the spring would be silent because there would be no birds, because they would all be killed by our use of DDT. And this really made people very frightened. And of course, people love nature. Everybody loves nature. Nobody wants to kill the little birds. And so it really had a tremendously powerful effect in spurring the beginning of the environmental movement.
Yeah, and I just want to go ahead and mention there is a late entomologist, Dr. J. Gordon Edwards. He did several really, really good articles, and one is called The Lies of Rachel Carson, and he goes over page by page, pointing out the different things that she wrote, and he rebuts it. So it's very good. I encourage you to check it out. Okay, so the book came out, then the EPA was formed in the early 70s. What happened after this?
Well, there was a proposal to ban DDT, and there was a lot of controversy about that. There were a lot of hearings, a lot of evidence was produced. They say maybe a truckload or maybe a trainload of evidence showed the value of DDT and how many lives it had saved. But nevertheless, despite the findings of the hearings, that it was very, very safe and that it was tremendously beneficial to public health, William Ruckelshaus, who was the head of the EPA, decided on his own that he was going to ban it. And you can read his decision on the Doctors for Disaster Preparedness website, which is ddponline.org. And over on the right-hand column, there's a link to DDT. And in there is the old scan of the typewritten document from Ruckelshaus with a few annotations by J. Gordon Edwards, followed by Dr. Edwards' testimony in the Congressional Record, and a lot of other commentary in there on the just scientific travesty that this was. I mean, Ruckelshaus didn't even get the chemical composition of the compound correct.
Yeah, I mean, from what my reading, and I understand, obviously I was very, very young at that time, but he, all these advisors even told him, hey, this is good stuff. The science proves it. And he eventually admitted it was a political move.
Well, it certainly gave tremendous power to the EPA. As people said, if the EPA can ban DDT, it can really ban anything. And it's brought in a lot of substitutes for DDT, such as methylparathion, which was admittedly, in the decision made by Ruckelshaus, admittedly it killed agricultural workers because it's an organophosphate and it is quite poisonous. But then they said, well, it doesn't persist so long in the environment, never mind that it kills people. DDT persists for a while in the environment, although not nearly as long as they claimed. But J. Gordon Edwards used to eat a tablespoonful of it when he gave lectures, and I know of no evidence that it ever killed anybody or sent anybody to the emergency room, even though it was extensively used on soldiers, concentration camp victims, migrant workers. It was responsible for getting rid of bed bugs. Back in the days when I went to school, there were no head lice. Now a lot of schools have weekly head checks to look for lice. And so it's taken a while for all these pests to come back, but they have been coming back. And probably worst of all is the millions of African babies that have died because of the public health people were not allowed to use it in its really best and most effective way, which is indoor spraying of homes.
But that has been reversed by the WHO several years ago, correct?
No.
It hasn't?
No, there is some sort of UN thing about persistent organic pesticides that would really like to get rid of DDT altogether. Some African countries have used it for indoor spraying.
Right.
And even though mosquitoes may have become resistant to the killing effects to some extent, they have never become resistant to the repellent effects, so that the mosquitoes just don't come into the houses. And so it's you do a very aggressive pest control policy, and you try to treat the people who have malaria so that they're no longer infectious. And these combined efforts can go a long way toward eradicating the disease. And we hope to do that back, in the mid 20th century. And now we've just sort of given up on the possibility of eradicating. I mean, there are billions of dollars being spent on reducing the amount of malaria in Africa by methods that are very expensive, much less effective, or the promise of a vaccine. Oh, we just have to have a vaccine, but we've been working on a malaria vaccine for decades.
Oh yeah, that's incredibly complicated too. It's
very, very difficult to get a vaccine, and nothing has been found that is very effective.
Yeah, the Sanofi Pasteur dengue vaccine that just came out, I think they were working on that for 2 decades.
Right, and this promise, well, let's get a Zika vaccine. We can have it immediately. Well, you can't necessarily just order up a vaccine. You have to do research, and maybe it works and maybe it doesn't. You don't know how safe it is. You don't know how efficacious it is. And in the meantime, you've got this Aedes aegypti mosquito, which is carrying not only Zika, but dengue and chikungunya and yellow fever.
Right.
There is a yellow fever vaccine, but that isn't all the best either, and is pretty toxic.
Now, based on the research that you know of, what are the effects of DDT on humans that are exposed?
Well, there are really no proven toxic effects. People have been trying to show that it caused cancer, but they've come up with no convincing evidence that it does that. If you start to whisper about, well, maybe we should bring DDT back to prevent deformed babies or to keep African babies from dying of malaria, they will say, well, we found a study where we looked at this or that, like Alzheimer's disease, and we looked at residual DDT in patients, and maybe possibly those who have Alzheimer's have a tiny bit more DDT in their tissues, which of course proves really nothing. But as soon as you talk about bringing it back, there are people who will come up with scare stories about how it's harmful to human, even though this has really never been proved.
And the other big thing is, especially with the environmentalist groups, is a supposed effect on birds and mammals and eggshells. And can you address that at all?
Yeah, that has been one of the most powerful arguments against DDT. I mean, I think that first you might want to get your priorities straight. You're going to say, how many African babies do we want to die in Africa to save some bald eagles in the U.S.?
Right.
So you could put, but the other thing is that all the hype about the thinned bird shells was based on very flawed evidence. That what happened was they fed the birds not only DDT, but a diet that was deficient in calcium. And one study that they did showed the thin bird shells, eggshells. But then when they repeated the study with an adequate calcium diet, it was proven that the birds did perfectly well with DDT as long as they had enough calcium. But they wouldn't publish that study in the original prestigious journal. That was published in some poultry journal that was very obscure. So most people never even found out about it, that this concern about the bird shells was fabricated. It was untrue. The birds were doing just fine. The bald eagles were coming back. The peregrine falcons were coming back during the years when DDT was still very heavily used. Like the peregrine falcon, it was threatened for sure, but that's because people were shooting it.
Yeah, I did some reading, and there's a lot of evidence that during the time DDT was used at its heaviest, a lot of these bird populations grew much more than after the banning of DDT.
Well, the Audubon Society was out counting the birds.
Right.
So, we have very good evidence that the bird population was doing just fine.
Yeah, it's funny. I was actually having dinner with a friend the other day, and he was telling me when he was a kid, he remembers, and this is like in the early 60s, late 50s, and when they'd go around and spray DDT for the mosquitoes, the stuff would get all over him, and it never affected him at all. And it just, it was an interesting conversation because he essentially agreed with what I was telling him. He's like, yeah,
they used to have these sprayer trucks go down the streets in Houston and spray everything.
Yeah,
but you get that much malathion on you, you are going to end up in the emergency room or possibly dead.
And that's because why? Because it absorbs through the skin, right?
Absolutely, yes.
Yeah.
DDT, you can eat it, it's absorbed through the skin, but it is very, very safe in humans. Maybe it's not 100% safe, but it's about the safest thing that's ever been developed. That's an effective pesticide.
Yeah, it's also quite affordable. I think I read that you can take care of a house for $1.44 a year or something. Some really ridiculous amount of money. So,
well, yeah, it's much more affordable than like the permeated bed nets that they want Africans to use, even though it's really hot and humid there. And it's when they could keep the mosquitoes out of their house by spraying the walls with DDT, and they'd only have to do it every 6 months to a year.
Now, I recently reported on the dengue fever situation down in South America. It's already more than 1 million cases, and Brazil has all the issues right now, and with Zika and dengue and chikungunya, and they also have yellow fever there. Yellow fever's swarming through Africa right now. Now, Tony Fauci, he's a doctor. He's the director of the National Institute of Allergy and Infectious Diseases. And he said this quote recently that during the 1950s and 60s, Brazil successfully eliminated the mosquito carrying the Zika virus through the use of DDT. And he said that Brazil was able to do this through an aggressive attempt to eradicate the Aedes aegypti mosquito. But he says now, he basically is saying it wouldn't be feasible today.
Well, I'm not sure why he thinks that something we could do in 1950 we can't do anymore. I mean, the reason might be because the public health authorities or the internationalists will not allow our most effective weapon to be used. I mean, Aedes aegypti mosquito was hard to eradicate. I guess in the Wall Street Journal it was called the cockroach of mosquitoes because it comes indoors, it bites during the daytime, it can breed in tiny quantities of water, can persist for a long time. It's hard, but it can be done. It's been done even today in small villages where they go house to house and look for sources of water, and they use larvicides and they use adulticides, and but it takes an effort. But why we can't do it today and we could do it then is a real good question.
Yeah, sure is. Now, you wrote in an article last month that the alarm about Zika will be a public relations exercise covering the waste of countless human lives and billions of dollars on ineffective and harmful campaigns if it does not open a discussion of why diseases on their way out in the 1970s are coming back now. So I got about 2 minutes left with you. You seem to frown upon efforts for a vaccine while these cheap pesticide, DDT in particular, are out there. Give me some final thoughts. What direction should we go? And would people reconsider this decision?
Well, we could work on a vaccine. I'm not against working on a vaccine, but there's no guarantee that we're going to find one, and it will certainly be very expensive. It will only protect against the one disease, whereas the mosquito is carrying a bunch of related diseases, many of which are far worse than Zika. And so we really need to concentrate on vector control because that will protect everybody. A vaccine might be a good thing if we got it, but how many vaccines are we going to give to people? We can't vaccinate against everything.
Right.
And pregnant women can't get or shouldn't get live virus vaccines. The vaccine could harm the baby too. So the only way to protect them is to keep them from getting bitten, and the only way to do that is to try to get rid of the mosquito.
Any chance that, about 40 seconds left, any chance that things will turn around and DDT will become part of the arsenal again?
Well, I think we need to really fight for that. And people who are against it really, really don't have a problem with African babies dying by the millions.
Yeah. All right. Well, thank you, Dr. Jane Orient, for your time and expertise, ma'am. I appreciate it.
Thank you.
You bet.